Glad you could be here with us. Just check with my producer, make sure the cameras are on. Welcome. If it's the first time joining us, I'm excited you're here. The way this works is I do two 24-minute segments. So I'll talk for 24 minutes. And then you, in the meantime, have any health questions, type them in. And at the break, I'll answer any of your health questions you have. Then I'll do another 24-minute segment. I'll answer your health questions again. This is an amazing opportunity for you to get questions answered. I don't know if anywhere else in the world you can do things like this, where you can ask an expert and find out if there's anything that you can do to help get you well and keep you well. So this is a great opportunity. Please do me a favor, too. If you're watching this live, put in hashtag live. If you're watching it as a recording, put in hashtag replay. This way the bots can search you and find you and know who's listening and who's doing what. And also share this link. Share it with your whole social media because this is really good information. We're going to talk today about unexpected signs of heart disease. And you're going to be surprised that many of you may have these symptoms, and it could actually mean you're having heart failure, and you don't even know it. So it's February. Of course, we want to keep it with the heart theme. But this is a great opportunity for you to share this, and you might save somebody's life. So please do that right now. Share the link to your whole social media. So I am ready to start whenever my producer says it's time to start. And she's giving me the sign that it's time to start. So here we go. Hey, folks, Dr. Joe Esposito here. Thanks for being here. We're going to talk today about unexpected signs that you may have a risk of heart disease. Now, some of you are going to listen to this, and it's hopefully going to save your life, because you'll be surprised at some of the signs and symptoms that are telling us that your heart isn't working as well as it should, and you never knew it. How about something like losing the hair on your legs, purple toenails? I mean, a lot of things like that you may have, and I'm going to go through a bunch, so stay tuned, and you're going to say, I had no idea. I better get this thing checked. So I hope today is a lifesaver for a lot of you out there, because these are signs and symptoms. And I lost my dad to heart disease, and he had rheumatic fever. And I'm going to start with why he had rheumatic fever. He had an infection when he was young. He had rheumatic fever, and the infection spread to his heart, and it hurt one of his valves. It damaged what's called a mitral valve. So years ago, he had to have a mitral valve replaced, and he lived for many years after that. But when you look at an x-ray of my father, his heart was about 3 times the size of a normal heart. Because what happens with an organ in the body is when it starts to fail, it gets bigger. So it could be the pancreas. When I take a look at patients' reports and I see the pancreas is extraordinarily large, something's wrong with the pancreas. When the heart is enlarged, something's wrong with the heart. The thyroid, called a goiter. So the body will try to make an organ bigger to do the job more efficiently. And so you may have some of these signs and symptoms not realizing that it's the body's way of saying, hey, something's wrong, fix me. Oh, my legs are swollen, it's no big deal. No, it could be a very big deal. It could kill you. So that's what we're going to talk about today. Unexpected signs that you're at risk of heart disease. So I don't want you to ignore these subtle signs because it could be your demise. Now, these days, we're paying close attention to health. And it's interesting, too, because, we study demographics, and we say, all right, who's going to listen to Dr. Joe? Well, traditional audience for someone like me would be women 25 to 45. Well, we don't fit that mold. We have listeners, teenagers, listening. We have men listening. In fact, I think my audience is much bigger in men than it is in women, which is very rare for topics like this. So we cross all barriers. And it's becoming more and more hip and cool to take care of yourself. Now, it doesn't necessarily mean you're thinking about your heart when it comes to health. I don't need to tell you the heart is pretty important. Now, day after day, behind the scenes, the heart's pumping 24 hours a day. When you start seeing these telltale warning signs popping up, I want you to say, wait a minute, I better not put myself at risk. I don't want to die because I saw the warnings and I didn't heed them. And you may not die, but it could incapacitate you. And I've had people do this. I mean, I've been in practice 38 years plus. And I've had people say, Dr. Joe, I listened to your lectures 20 years ago, 30 years ago, 40 years ago. I was even lecturing when I was a student. And you told me that if I had blank symptom, it could lead to blank. Acid reflux could lead to esophageal cancer. Low back pain can affect the colon, sex organs, and bladder. Neck pain could cause the joints to wear out. Anyway, whatever it is. And patients come to me all the time and say, Dr. Joe, I heard you talk 20 years ago about low back pain or neck pain or whatever it is, and I didn't listen to you. And now I have esophageal cancer. And now my colon, sex organs, and bladder aren't working. Now I have severe arthritis throughout my entire spine. I wish I'd listened to you. And I hear it all the time because I've been around for a long time. And people say, you were right. I don't want to be right. I just want you to get the best care possible, the best approach to get you well and keep you well. So the signs and symptoms we're going to talk about today, I don't want you to ignore. And one of them is a toothache. So if you have a toothache, sometimes it requires a trip to the dentist, but sometimes it could be a symptom of a heart attack. The pain might feel like it's radiating upwards from your teeth, along the jaw, or even into your ear. That could be a sign of a heart attack. Oral bacteria can get into the bloodstream through inflamed tissue and settle into heart valves. And that can create bacterial plaques that lead to heart disease, heart attacks, strokes, and more. So that's why if you have a heart condition, before they even will do most procedures, they're going to tell you go see a dentist. I remember my dad had to go see a dentist every time he'd have a procedure done on his heart, because if there's an infection in a tooth, the same membrane that covers your gums also covers your heart. So infections can go from your teeth into your heart. And if you start having shooting pain up into your jaw, that could be a sign of a dental problem. It could be a sign of a heart condition. So don't ignore it. And if you go to the dentist, ask them, could this be a heart condition? Because you would think that doctors would know to ask those questions. Well, doctors don't. Now, there are good dentists and good chiropractors and good surgeons, and there are bad ones. So you have to take control of your own health. And that's what these shows and these lectures that I do are all about. It's having you take control of your own health. Because you think, well, the doctor's going to find this. Not necessarily. You ever have construction work done in your house? Contractor comes in. Well, if there's a leak, they'll fix it. No, not necessarily. So don't expect anyone to get to the cause of your problems. You have to take some responsibility. So with these symptoms, consider that. Another symptom that could mean that the heart is not working as well as it should is you cough up pink or white mucus. Now, if you find you're coughing up pink or white mucus as opposed to just like clear mucus, it could be a sign that the heart is not really healthy. Long-lasting cough that produces strange-colored mucus could be the result of something called heart failure. The white or pink color may result in blood leaking into the lungs because the heart isn't pumping hard enough. So blood can leak into the lungs and then you cough it up. So let me explain heart failure. Heart failure does not mean your heart has stopped. It's just not working as well as it should. My mother in her final years was in heart failure. And that's a scary phrase when the doctor says you have heart failure. Well, it just means the heart isn't working as well as it should. It simply means the heart should be pumping better than it is, and that's according to the U.S. National Library of Medicine, so that's by definition. Now, discuss this symptom with your doctors to come up with a plan to improve your heart health. Now, I have to laugh because that sounds like a brochure, doesn't it? Discuss this with your doctor. And many times you go to your doctor and say, hey, doc, I'm coughing up pink mucus. All right, well, we'll put you on antihistamine. No, pink mucus could mean my heart isn't pumping hard enough and blood is getting into my lungs. Oh. Yeah, okay, maybe we should do a CAT scan or an MRI. So I'm always amazed that you assume that the doctor knows everything. Don't assume that at all, myself included. When patients come to us, we do an intake form on the patient. And many times I talk to the patient, and as we're talking, the spouse is in the room. Oh, don't forget to tell them that you also have acid reflux. Don't forget to tell them you have a stent in your heart or you have spinal rods put in. So it's really important that you share this information with your doctors, and then a smart doctor is going to say, I got to do something with this. But pink mucus is not a good idea. It's not a good thing. And so that could be a sign of heart failure. And then it says, talk to your doctor about a heart plan. Well, most doctors, and this is not a dig on medicine or other doctors, most doctors are not taught anything about nutrition. They're not taught anything about supplements. And so that's why so many doctors refer their patients to us and say, Dr. Joe, can your team do a workup on my patient, and let's try to figure out what's wrong. Those are the good doctors, the progressive ones. The other doctors are like, we don't know. I don't know. And so if you really want to get well, you have to start taking control of your health. And if you want to come see us, we'd love to have you as a patient. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. And we check the nervous system, we check the digestive system, and we check your diet and supplements. So if you'd like to do that, just go to website drjoe.com. You can book an appointment right now, and we can usually get you, if we had to, within 24 hours, an appointment. But we can book it out in the future if we need to. But Yeah, don't ignore symptoms. And that's what this whole show is about. Don't ignore symptoms. They're telling you that there's something wrong. And we said earlier about swollen limbs. It's called edema, and that could be a sign that the cardiovascular system just isn't capable of pumping blood like it used to. So feet and hands being swollen for a long period of times is a sign that blood is not being pumped properly. And when blood is not being pumped properly, it collects in the place that's furthest away from the heart, because that's where the heart has the hardest time to push it. That's hydrodynamics there. If you find any part of the body is constantly, unexplainably swollen, you need to get that checked. Now, there's something called edema that occurs, and there's two types of edema. There's pitting and non-pitting edema. So pitting edema is I push on it, and it feels like Play-Doh. I push my finger, and it leaves an indentation. That's bad. If you see that in the ankles especially, you want to get your heart checked by a cardiologist, not by me, by a cardiologist. Because that could mean that the heart just isn't strong enough to pump the blood and flush it back up into the heart. It goes, out through the arteries, up through the veins. And if it can't make that trip because the heart isn't pumping hard enough, you get this pooling, this pitting of the edema. Bad sign, get it checked. Non-pitting edema is I push on it, bounces right back. That's not as dangerous in most cases. It's like I sprained my ankle and I have non-pitting edema. It's swollen, I push, it bounces right back. But if you start having swollen limbs and you don't understand why, you want to get that checked. Now, I hear this from patients, whether it's my office, other doctors' offices. Well, that's a lot of money. Yeah, it's your life. And, in our office, chiropractic, for example, chiropractic is the most effective, least expensive treatment for back pain. So patient comes in, that's a lot of money. Well, my insurance has a $5,000 deductible. Don't have such bad insurance then. Or don't use your insurance. Or get catastrophic insurance where your premiums are really low and then you pay out of pocket for smaller costs. Or about 50% of our patients just pay cash because it's so inexpensive anyway, but we want to get to the cause of the problem and not just treat the symptoms. And my question to the patient is always, if your transmission fell out of your car in the parking lot right now, would you fix it? Well, I have to. I have to get my car to drive to work. Do you have insurance to cover that? No, I don't have insurance to cover that. Okay. So consider your priorities. What's important? I take supplements every day. There's a cost to that. But my health and my energy and my vitality and my youth is certainly worth a couple of bucks. And what happens is when you start taking care of yourself, this is the ironic twist of the whole thing, is it's so much less expensive in the long run. If you're healthy, if you have energy, if you feel good, if your brain doesn't have brain fog, if you can go to the bathroom properly, you're going to work harder, make more money, not spend as much money on healthcare long term. You're eating good foods, which are way cheaper than bad foods. So when you take on a holistic health approach, most of the time you're going to save a ton of money. Now, there's scammers out there. I know that. I've had patients go, I went to this one doctor, it was $5,000, and they didn't do a fraction of what you just told me in 10 minutes. Well, there's scammers out there, and that's unfortunate. I hope there's a special place in hell for them. But try to do the best you can to get well. And that's why on our website, drjoe.com, we have over 3,000 hours of podcasts, and they're all free. Listen to as many as you want. Listen to all of them if you want. So drjoe.com is our website, great source of information. You can also book appointments, see us. We're going to talk about some supplements in a second. They're available on the website. If you have any questions, you can send them to me through the website as well, drjoe.com. So swollen extremities, talking about heart disease, a risk of heart disease, is a sign that there's something wrong. Now, I said earlier, almost off the cuff, you're losing the hair on your legs. You found that your legs are no longer, for women especially, don't require as much shaving. That could be an underlying heart condition. The nutrients that are necessary to grow hair are distributed via the blood. And if you're not getting proper blood supply, the hair can fall out. And that could be a pretty serious issue. My nose started itching all of a sudden there. Sorry about that. So sudden hair loss on your legs could be a sign that the heart is having trouble pumping the blood. If you notice this on your lower extremities, that's the furthest away from the heart, that could be an issue. Now, as we get older, especially for men too, the hair falls off your legs. You don't have as much testosterone and your body isn't as hairy as it used to be. And unfortunately, it grows in new places like your ears and your back, right? Makes no sense. But I remember a couple of years ago, I wore shorts. I was visiting my mom. And she said, you still have hair on your legs. That's surprising. And I said, why? She goes, well, most men your age, the hair falls out because the testosterone levels drop. And I said, well, I take care of myself. I take supplements to keep my testosterone levels high. I keep my body in motion. I eat the right foods. I stay away from estrogen-rich foods like meats and dairy products. And she said, well, obviously it's working. Because most men your age, most Espositos your age, don't have any hair on their legs. I said, good. It really works. And that's the thing. I live this lifestyle, and, you know, I don't get to eat meatball sandwiches and steaks and the foods that taste good, if I remember. It's been a long time. But I look at is it worth it? The answer is a resounding no. Eating bad foods, not taking care of yourself, it is not worth it. Financially, longevity-wise, energy-wise, brain function-wise. So my brain is getting better as I get older, not worse. Most people at my age and older, and younger even, have brains that just don't work. So I don't want that. Like Irene Cara said, I want to live forever. I won't, but I want to. All right, so I'm Dr. Joe Esposito, if you're just tuning in. We're talking about signs and symptoms that you might have a heart condition. And I said earlier, too, purple toenails. If your toenails are turning purple, that could be, I mean, you stub your toe or something like that, of course, that's one issue. But if it just happens and there's no trauma, it could be a sign, once again, the heart isn't pumping hard enough, you're not getting oxygen to the extremities. And it's probably due to clogged blood vessels, which indicates disruption of circulation. Now, if the issue is left unattended, it could lead to what we call necrosis. Necrosis is when you don't get blood to a part of the area of the body and it dies. And that's bad. Now, just the other day, I had a patient come in. He wanted to meet with me specifically, and so I met with him. And he brings in his young guy. He's 43 years old. He hands me his cholesterol score, and the cholesterol score was really high. And he says, I went to the doctor. He says, I don't know why your cholesterol is so high. Let's get you on some drugs. And I said, I'm not against drugs. But I said, okay, but did he tell you why the cholesterol is high? He said, no, he just put me on drugs, and I don't want to take the drugs. I said, well, I'm not telling you to take or not take the drugs, but let's find out why the cholesterol is high. And one of the things that happens with circulation heart disease is the cholesterol can go high because your liver is clogged up. So what happens is you produce cholesterol. The liver spits it out, goes into the blood system. It's used to do a lot of things. Cell walls are made with it. Hormones are made with it. And what's left over goes back into your liver and gets recycled. That's a real simple way of putting it. Well, sometimes those recycle bins get full. They're clogged up. They're not able to process the excess cholesterol, so it doesn't get recycled, yet your liver's still pumping out cholesterol. And so that can raise the cholesterol levels. So what we have to do is unclog the liver. And there are certain supplements. We have something called a 21-day detox. And I find that when people do that, in most cases, their cholesterol drops dramatically. And they go back to their doctor. Doctor says, what'd you do? Well, I did what Dr. Joe said. And most doctors know who I am. And they say, oh, Dr. Joe said it, absolutely, just keep doing it. It's great. Obviously, your cholesterol is lower. It worked. So we try to get to the cause of the problem and not just treat the symptoms. Don't stop your medication, but let's try to get to the cause of the problem so you don't need the medication. And that goes for neck pain, back pain, shoulder pain, digestive issues, in his case, cholesterol, hormone issues. So if you're serious about wanting to get well, go to my website, drjoe.com. Make an appointment to come see us. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. Normally, the first visit is $910 or $12. We've reduced that to $299. For my listeners. That's an exam, x-rays, consultation, first treatment, going over the x-rays on your follow-up visit, and a complete nutrition evaluation. The x-rays alone are going to cost you way more than that anywhere else. So if you're serious about wanting to get well, whatever the issues are, health, neck pain, back pain, shoulder pain, nutritional issues, digestive issues, drjoe.com, we want to be your doctors. We want to get you well and keep you well. And if you're ever in a car accident, you need to call us immediately. Because if the car's damaged, in my experience, you're damaged. I've never seen it any other way in 38 years of practice. So if you're in a car accident, please come see us right away. Don't waste time. The insurance companies will start to jerk you around. You might start getting weird phone calls from people saying, oh, go see this doctor, go see this lawyer. That's a scam. Don't fall for the scam. Again, I hope there's a special place in hell for those people. But usually those doctors and lawyers don't do the best work. Because they really it's just a mill. We call it a mill. They just pump people in and out. They run up the bills. They close the case. They move on. So if you want to get well, drjoe.com. Let's see if we can be that person to help you do it. So we're talking today about signs and symptoms that could be a sign of heart disease and what to do about it. Heart disease, by the way, in most cases is very manageable and oftentimes reversible through diet. And there's so much research out there. Dr. Greger reported on it. Dr. Sinatra, when he was alive, did the research on it. There's so many medical doctors and cardiologists that have done the work and clearly show that a plant-based diet many times can stop and oftentimes reverse heart disease. When before the research was done, heart disease was forever. Nothing you can do about it. You're probably going to die from it, and that's how the game is played. Now we're finding through all these other doctors doing all this research on patients, one-on-one patients, put them on a plant-based diet, watching the changes occur. That's another reason I'm on a plant-based diet. One of the many. I don't want to have my heart stop. Other things that could be a sign and symptom you have heart conditions. Can't catch your breath. You're getting winded when it's, you run upstairs or something like that, you might get winded, but basic stuff, walking up a few stairs, suddenly you can't breathe. Could be a sign that your heart is having an issue pumping blood. Now, people may think you're just out of shape, but running in the gym isn't going to fix it. The way to work with heart disease patients is through diet. Always. Now, chiropractically, of course, the nerves in the upper neck, lower neck, upper back control the heart. We want to fix that. If you have acid reflux, heartburn, burping, gas, bloating, you can affect something called the vagus nerve. The vagus nerve controls your digestive system, but also has some control over your heart. That's not heart disease, it's heart function. And so many times when we fix the patient's stomach from acid reflux, we pull the stomach away from the diaphragm, their blood pressure drops, their tachycardia goes away, their fibrillation stabilize, and the heart starts to beat better. Because we always have to look at the nervous system, and it's so overlooked in healthcare. Something wrong with the heart, treat the heart. What about the wires that go to the heart? What about the nutrients that go into the heart? What about the blood supply to the heart? So oftentimes those things are overlooked. And that's okay. That's my job. My job is to get to the cause of the problem, not just treat the symptoms. So if you can't catch your breath, it could be a sign. I remember when my father, when we found out he needed to have a valve replaced, I came home, I was out with my friends, and he was sitting at the kitchen table just gasping for air. Couldn't catch his breath, and he was just sitting there. And he looked at me, he was turning yellow. And I got real scared. So I was a big, brawny football player, so I picked him up, I sort of carried him upstairs, I put some shorts on him, he was sitting here in his underwear, and the ambulance came, brought him to the hospital, and they pumped his lungs. Because his heart wasn't able to pump, fluid built up in his lungs. And they pumped all this fluid out of his lungs and said another hour or two he would have been dead. So the fact that he couldn't catch his breath, we thought, well, he just doesn't work out. He's getting older. He's overweight. No, it was that. And again, I was in high school at the time. And so many of my experiences that I've had with my family and with my friends have led me into this field because I want to help you. I wish somebody had talked to my father when he was younger. I wish somebody had talked to my mother when she was younger. And so a lot of things we can avoid by simply getting to the cause of the problem, not just treating the symptoms. So my prescription for you is if you have these symptoms, get them checked. You come see us, go see a cardiologist, but get these things checked because it could be a sign that there's something very seriously wrong. Now, as far as supplements go, there's a supplement, because everybody I feel should take Dr. Joe's Super Greens and Dr. Joe's Essential Source. If you're not taking them, you should. They're two powders. They taste great. I mix them together every morning. Add some frozen bananas to it, frozen strawberries. People mix it with yogurt. I don't care how you get it in you. Just get it in you. But there's another supplement called nitric oxide. Nitric oxide opens up your blood vessels. Now, if you have normal or high blood pressure, it's usually safe for everybody. And I just had a patient the other day stop me in the hallway and say, Dr. Joe, I started taking nitric oxide. Oh, my God, I feel great. He said, I took Super Green Essential Source and nitric oxide. 3 days later, I thought, why am I feeling so good? So that's something you might want to consider adding to your protocol. Now, people always say, what supplement can I take for blank? There usually isn't one supplement for anything. It's a lifestyle. It's a protocol. Get the nervous system working. Get the digestive system working. Look at your diet. Get on supplements. And then you have an opportunity, it's a healthcare plan, an opportunity to get to the cause of your problems, not just treat the symptoms. So if you can't catch your breath and it's abnormal, all right, you don't work out, you're a little overweight, you walk up a couple of flights of stairs, yeah, that's one thing. But you get from your chair to the bathroom and you're holding on to the wall, don't ignore that. Okay, and the same thing with exercise. You used to work out all the time, and now suddenly you're not able to exercise as intensely as you used to be. So gradual decrease in exercise tolerance could be a sign of a worsening heart function. So you might notice anything from fatigue to weakness to something alarming, such as chest pain. Now, we're going to get to chest pains very next segment of the show. But these are all signs that aren't chest pain that could be leading to heart conditions. Now, folks, if you have any healthcare questions, send them to me through my website, drjoe.com. If you want to make an appointment to come see us, and I think you should, drjoe.com. We have offices in Marietta, Duluth, Stockbridge, and West Cobb in the Atlanta area. And we want to be your doctors. We want to help you. And you can search the website and search for whatever you're looking for in the search bar. Follow us on social media. We post every single day at Dr. Joe Esposito. Folks, I'm Dr. Joe Esposito, drjoe.com. We'll be right back. All right. Any questions on the first half of our amazing show?
Yes. So someone was wondering, what magnesium supplement would you recommend?
One that has several different types of magnesium in it, because different magnesiums do different things. Magnesium citrate is one of them. But something that has like 2 or 3 different types of magnesium, that's the best kind of supplement for that. So don't take just an isolated one. Take a group, okay? What else? Calm is a good brand, C-A-L-M. I have no relationship to them whatsoever. They give me no kickback. I just know they're a good brand. So, what else?
That's all.
All right. Let's keep rocking here. La, 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 la. Ready? Hey, folks, Dr. Joe Esposito here. What we're talking about today are surprising signs and symptoms that you might have a heart condition. And we talked the first half of the show, we talked about a lot of things. We didn't talk about chest pain. Chest pain's obvious. It feels like an elephant stepping on your chest, get shooting pain down the left arm. I got to do something about it. We're talking about the less obvious ones because I've lost people to heart disease, and sometimes it's unavoidable. But in many cases, you can avoid it. And it'll save you a ton of money, probably add a bunch of years to your life, because you want to get anything when it comes to healthcare. The earlier you detect it, the easier it is to fix, whether it's neck pain, back pain, shoulder pain, heart disease, diabetes, cancer. The earlier we detect it, the better results we're probably going to have. And so the signs and symptoms we're talking about are things you might not even think about for a heart condition, but it could be. And if it is, you want to find out why. And I said earlier that the treatment, not just the symptom cover-up, but the treatment is a plant-based diet. There's so much research out there. There's books written on it. This is research by cardiologists. This is research by medical researchers. Plant-based diet is the most effective, least expensive treatment when it comes to heart disease. Now, I'm not saying don't do your other medications. Don't not listen to your cardiologist. But so much research is out there showing that going to a plant-based diet can oftentimes prevent heart conditions and in many times even reverse it. Where before it was never reversible, now we're finding out it can be in many cases. Same guidelines we do for diabetes. Plant-based high-fiber diet. Most type 2 diabetics, if they took control of it, type 2 is almost always avoidable, many times manageable, and sometimes reversible. So why wouldn't you do that? If I had a pill that would do that, you'd take that pill every day, right? I could charge you whatever I wanted. And yet we have something that's cheaper than what you're doing right now, because the foods you eat that are healthy are less expensive than the bad foods. Cheaper than what you're doing right now, and is very effective with very, very few side effects, except health is one of the side effects. So that's why, if you don't know what to eat, go to my website, drjoe.com. Type in the words 7 Deadly Sins of Nutrition. Generally speaking, that's just general information. Those are the 7 foods you want to cut back or cut out of your diet. So then type in, so what can I eat? And there we talk about what you can eat. And again, that's a general protocol for overall health. And if you want something more specific, you can come see us and we can do an analysis with you and find out specifically for you. But generally speaking, that's what works so great. So other signs and symptoms that your heart may not be working as well as it should: uncontrollable vomiting and nausea. From the bottom lining of the heart that surrounds the structures of the stomach is inflamed, so they're kind of almost connected to each other, the heart and the stomach. They produce similar reactions and feelings as nausea, abdominal pain, and even vomiting. And that's the Mayo Clinic saying that. And these symptoms are more prevalent in women than in men. So women have different symptoms of heart attacks than men. And one of them could be the nausea, but men can get it too. And oftentimes a feeling of anxiety. You feel heaviness in your chest, you feel anxious, because the heart isn't working as well as it should. And the body says, wait a minute, something's wrong. I better get, Joe's attention. And it creates anxiety. So excessive anxiety, feeling heavy in your chest could be a sign that the body's saying, hey, take a look at me. That's what symptoms are. Symptoms are your body's way of telling you, hey, pay attention. Something's wrong. And so often we ignore the symptoms. And we do that as a chiropractor. I see it with neck pain and back pain and shoulder pain, sciatic pain. It's no big deal. It takes some acetaminophen. I'm not going to worry about it. Well, 90% of your nerves don't feel pain. So you could have a pinched nerve and not know it. So if you have pain, you have a pinched nerve. If you don't have pain, you might still have a pinched nerve. So my doctors can actually check the nerves that feel pain and check the nerves that don't feel pain to see if there's an issue. Other signs and symptoms. You're struggling in the bedroom, specifically for men. Now, it's entirely possible it's simply a sign of stress or aging or hormone levels, but many times for men, and when it comes to bedroom performance, the blood vessels get clogged up. Now, the blood vessels in your reproductive organs are really tiny, and so you get a little bit of plaque built up in there, you just can't get blood flow going in. And that becomes a real serious issue. And that's a warning sign. It's not just, I'm getting old, I'm stressed out. Yes, that can happen. But if your heart isn't pumping hard enough as it should, the decreased blood circulation can lead to weaker function in the bedroom. So talk to us or your doctor about these symptoms, because it could be a circulatory issue. And again, that's where Supergreens and Essential Source come in to give your body nutrients that it needs, nitric oxide to open up the blood vessels. If you're taking medication, I also advise something called glutathione. Glutathione helps the liver clean itself out. The chlorella in Dr. Joe's Supergreens is a great way to get the liver to clean itself out as well. So I wish, in my fantasy world, that if anyone's on medication, the doctors would talk about how the patient should take care of their liver. So anybody listening right now, if you're on medication, chances are very high, I'd say 100%, but I never say 100%, that the liver is being adversely affected. Any medication, doesn't matter what it is, birth control pills. And so that's why I do recommend things like chlorella, I do recommend things like glutathione to keep the liver as healthy as you possibly can. Because if you need the medication, sometimes you do, if you need the medication, we also want to keep the body as healthy as it can to detoxify that and get it out of the system. So any liver, any medication, any liver would be Supergreens, an Essential Source. They kind of go together. And then glutathione to take care of that liver. Because so many people take medication, they get adverse reactions to it. And now it's too late sometimes. I don't want to get to that point. So we can help that. And that can help the circulation too, and the clogged arteries, again, usually almost 100% cleanable, is that a word? Able to clean it out through diet. And why wouldn't you do that? And that's the cool part about this. If you get the nervous system working, the digestive system working, your diet straightened out, there's no downside. Is it going to cure all your problems? Probably not. Is it going to help most of them? Absolutely. But there's no downside to being healthy. There's only upside. So why wouldn't you do everything that's good, and the things that that are bad, stop doing them? I don't know. I don't understand it. Now, I know we give a lot of information. Follow us on social media at Dr. Joe Esposito. We post information every single day. So you want to follow us, Facebook, Instagram, YouTube, TikTok. Yeah, we started doing TikTok now. And follow us because you're going to get so many helpful hints like this in little tiny bite-sized chunks. We'll post something. Oh, that's a good idea. That's it. And social media, of course, following us is no charge. But follow us on social media. We do coaching programs. We do very small group coaching programs. You probably want to be part of that. We just did a 21-day detox weight loss program, 4 weeks, and I did social media on it. And everybody that did it, lost their mind. Dr. Joe, not only did I lose weight and clean up my liver, I feel better, I have more energy, I have control over my diet. I don't crave sugar anymore. I don't care about coffee. I don't care about cookies anymore. So it's not just your diet. We reset the brain on these people. And so you're missing a lot if you're not following us on social media at Dr. Joe Esposito. A lot of good information. So we're talking about other signs and symptoms that could be a sign that your heart isn't working as well as it should. You start sweating excessively. Now, you're not exercising, you're not being particularly active, and all of a sudden excessive sweating, that could be a sign of a heart attack. We talked about that anxiety, that chest heaviness. Excessive sweating could be a sign of going in with the stress. So this is a study in from the American Heart Association. It means that you're getting to the hospital as soon as possible, especially if the perspiration is accompanied by discomfort in the chest, the arm, the jaw, usually on the left side. So you start sweating profusely, you start getting chest pains, anxiety, shooting pain down your arm, jaw pain. Chances are you're having a heart attack. Get to the hospital immediately. Don't call me. This is not a chiropractic case yet. Let's keep you alive. Then let's get the nervous system working. Let's get the digestive system working. Let's get you on proper nutrition, and let's see what we can do to help stabilize and maybe reverse a lot of the heart conditions. But if it's an emergency, that's an emergency room. Heart attack, emergency room. Stabilize, Dr. Joe's offices. It's really simple. It's not hard to figure this out stuff. And then hopefully we get you to the point we don't ever have to go to the emergency room again. They're busy over there. They don't need your business. They're doing fine, okay? Take care of yourself. Another sign that the circulation may be an issue and the heart issue is you have open sores on your feet. Especially if not healing on their own, any open sores on the feet should be checked out by a doctor. It could be a sign of a specific heart condition called arteriolytic occlusive disease. And what that means is just basically clogged arteries. Blockage of the aorta. The aorta is the big blood vessel that brings blood down. It splits around your third lumbar, becomes the common iliac arteries, and that goes down to your legs. Don't worry about the anatomy. But if the aorta and the common iliacs are occluded, that's why it's called iliac occlusive disease, it's hardening the arteries. Now, I talked earlier, I didn't dig in deep enough, I guess I should, where cholesterol was high. And we can get you on medication if you need to, but also on nutrition to help clean out the liver and recycle the cholesterol. But it's not just the cholesterol floating around in your blood that's dangerous. It's also the cholesterol that's stuck to your artery walls. It's like if I have a pipe, a sewer pipe, and it's just full of junk, but the water's flowing freely, well, that's okay. We're getting rid of the junk. If the pipes are clogged, that's when it becomes an issue. And so just checking cholesterol is okay, but I want you to check to see if there's inflammation in the body. You want to check something called a C-reactive protein. C-reactive protein determines how much inflammation there is in the body. It doesn't tell you where it is. It just tells you if the inflammation is high. And I also want you to check your homocysteine levels. Homocysteine tells you how much cholesterol is stuck to the artery walls. It's a good indicator. And so if the cholesterol is stuck to the artery walls, that's the damage. So in theory, you could have normal cholesterol and still have a heart attack because the cholesterol is all clogging up the artery walls. B vitamins help lower your homocysteine levels, which helps lower the plaque building up on the artery walls. So I think that anybody who has any risk of heart disease or has heart disease or calcium score or hardening of the arteries should be put on B vitamins immediately. It's really cheap. It's really effective, along with dietary changes and everything else. But I don't know why that's just not standard. I would think cardiologists should just have boxes and boxes of B complex. Dr. Joe's B complex, of course, I'd like for them to have. And just hand it out to every patient. They say, take this, take this, take this. Let's bring down your homocysteine levels. Let's see if we can prevent the plaque from building up on the artery walls. There's other things that cause it too, but that's an easy fix. So I don't know why doctors don't do that. They should. But again, if you, I digress. If you have open sores on your feet, that can be a sign that the arteries are clogged and we got to unclog them. And I've had people come in and say, well, doc, I was 100% occluded and they went in and put a stent in. Anybody ever have that? Stent put in your heart? I was going to say a brand name, but a plumber come in and clean out the pipes. That's all well and good. Probably saved your life. That's great. Did anyone ever have their doctors tell them, okay, now I want you to stop doing the things that caused this to begin with? Because even if we put a stent in your heart and you keep doing the same things, guess what? It's going to come back. And I don't get it. I don't understand why they don't sit down and say, all right, go see Dr. Some do. Go see Dr. Joe. Let's get you on a plant-based diet. Let's get you on some B complex. Let's get you on B6 to help lower the homocysteine levels. Let's get you on some nitric oxide to increase circulation. Let's clean out the liver with glutathione and super greens, the chlorella. And let's put together a wellness plan so that I don't have to see you again as a patient. I don't know. Bothers me. Anyway, if you do want to come see us, folks, again, I'm not a medical doctor. I'm board certified in chiropractic, orthopedics, pain management, double board certified in nutrition. If you want to get a wellness plan put together, drjoe.com. We have offices in Marietta, Duluth, Stockbridge, and West Cobb in the Atlanta area. Normally, the first visit is $912. We've reduced that for my listeners to $299. That's an exam, x-rays, consultation, first treatment, going over the x-rays, complete nutrition evaluation. Why are you not doing that? It's cheaper than dinner for two in a fancy restaurant. That's probably not going to save your life. What we do might. I'm not saying we will, but we might. So drjoe.com, make your appointment right now. Any questions about your insurances or anything? We accept people with all insurances, no insurance. We have payment plans available, Care Credit, which is a payment plan up to 18 months without payments, interest-free. Not without payments, I'm sorry, interest-free. So I don't know how to make it easier for you. When a patient says that's a lot of money, it's not a lot of money. What we charge compared to, I used to say, a year's worth of treatment in our office is less than 1 day in a hospital. Well, that's true. And then one day I cut my mouth, and that was an emergency. I went to the emergency room. And it turns out that a year's worth of treatment in our office is less than 3 hours in the hospital. It's a good investment to get well and stay well. drjoe.com. Make an appointment. Stop suffering. Other signs and symptoms that you might be having a heart issue, a heart disease, jaw pain. We talked about that earlier. It can manifest a heart attack, some cardiac events. You feel it in the jaw, your teeth, and your neck, usually on the left side. But it can happen on the right side too, especially in women. So again, women and men, Joe Jackson had a song called It's Different for Girls. And yeah, it's different for girls when it comes to heart attacks. So men, usually the left side, but it could be the right. Women, kind of both sides. So be careful with that. It means that the jaw pain could be signaling something is happening to your heart at that very moment. So quick springing into action is something that's going to be required. So if you have pain up in the left area, shooting down the shoulder, get it in the heart, get it in the jaw, something's wrong. Get it fixed. Now, it could be a pinched nerve. I damaged my ribs very badly. I got hit by a car when I was 10 years old, severe traumatic brain injury. And again, you wouldn't know I have a traumatic brain injury, would you? I do, but I take care of it. I'm always going to have a traumatic brain injury. It's never going to go away, but I take care of it. My brain works pretty darn good. But when I did that, I think it was then, my collarbone got damaged, my ribs got damaged, and if my ribs on my left side go out of place, I have all the symptoms of a heart attack. I have shooting pain down my left arm. I have pain up into my neck. I don't have the anxiety, I don't have the sweating, but a lot of the symptoms, I should say. And so I remember getting my heart checked years ago, and I said, Joe, your heart's fine. God, you have the heart of a child. So then I knew it was a structural issue. And I know if I sleep on my left side, I get all these symptoms, blazing pain in my shoulder, my head. When it acts up, I have to get my upper ribs adjusted along with my spine. And then I have to get my pelvis stabilized, and I have to get my stomach adjusted. And then, almost instantly, all the symptoms go away. So a lot of the symptoms I told you here are not necessarily the heart. Could be. But in me, it's ribs. And I got to get my ribs adjusted. It stinks. I got hurt pretty bad. I have permanent damage. But without chiropractic care, without the knowledge that I have, I'd be in pain every day. Literally every day. I know I would. Because one time I was away from my office for a couple of days, and it acted up, and it every day and every night. Got in, got adjusted. Within 10 minutes, I started to feel better. So consider that a lot of the symptoms you have, neck pain, back pain, shoulder pain, probably are not your heart. It's probably pinched nerves. But I rather err on the side of caution. Get these things fixed. Other signs and symptoms you might be having heart issues. Urge to hit the bathroom constantly. If you haven't recently increased your water intake, an overactive bladder could be a sign of heart problems. Urinary incontinence and overactive bladder could be a sign of heart problems. Now, there could be an underactive bladder, and that's called neurogenic shock. When I had my traumatic brain injury, way back when, I think I was 10 or 11 years old, I couldn't urinate. I went into neurogenic shock. So too much or too little is not good. Okay, for me it was days, and they had to catheterize me. That was not pleasant. But the issue was that my nervous system shut down because of traumatic brain injury. So just be careful with that. And that's why I became certified in traumatic brain injury, because I want to learn how to treat these folks. And I had to laugh because when I took the class, they had one paragraph, one page that I remember on nutrition. This other thick book was all talking about, well, you got a traumatic brain injury. Sucks to be you. And this is how you get government funding, and this is how you get your family to deal with it, and this is how your family learns to cope with the fact that you have a traumatic brain injury. And again, mine, I'm still functioning. Some of them are severe. It could be, paralyzed, brain damage where they can't function. So I wish they'd talk more about what to do. action steps. And that's what this is. It's all action steps. Other signs and symptoms your heart may not be working. You feel like you're choking. Angina actually means choking. So angina is chest pain, but you feel like you're choking and it's in that heart area. If your heart starts to flutter, you're fluttering in your chest. That's called AFib. Now, AFib, many times they'll go in, they'll shock the heart to try to reset it. And many times it works. Sometimes it doesn't. But what I found in my career is AFib many times is associated with the stomach pushing up against the diaphragm. So if the stomach pushes up against the diaphragm, you irritate something called the vagus nerve. Now, the vagus nerve controls your enteric nervous system, your digestive system, but also controls your heart. And so when I was a kid, I remember laying in bed in Hoboken, New Jersey, and one of my earliest memories of being alive, and my heart would just pound and pound and pound. It would flutter, and then it would stop, and it would start again. And I remember thinking, my heart just stopped. It's not beating. I should be dead. Oh, there it goes. And all those years, until I was about, I don't know how old I was, probably in my 30s, before I realized it was related to my stomach. And when I get my stomach adjusted, pull the stomach away from the diaphragm, my burping, my acid reflux goes away, but my heart goes back to normal beating again. And I've seen it happen countless times. Once again, I'm not saying I have a cure for AFib. I am saying with my experience, personally, as well as with patients, it could be a digestive problem. I've had a lot of people go get their gallbladder removed because they have digestive problems, and it wasn't the gallbladder, it was the stomach. We pull the stomach away from the diaphragm, and they're angry. Why did the doctor pull my gallbladder out when I was having digestive problems? Because they couldn't find out what was wrong. So they said, well, let's give this a shot. I'd rather we pull the stomach away from the diaphragm and give that a shot and see how we do. That's a much better choice. Now, again, you can always have your gallbladder removed later, in most cases. But many cases, it's the stomach and not the gallbladder, my personal experience. So the fluttering in the chest, AFib, anxiety could be the digestive system. And that's a much easier, quicker, less dramatic fix than some of the things going on. If you start experiencing confusion, memory loss, impaired thinking could be a sign of blood flow, or it could be an imbalance of nutrients like sodium. The way the nerves work in the body is you have sodium and potassium, and one's on inside of the cell, one's on the outside of the cell, and they switch back and forth. They jump in and out of the cell. And when that happens, that creates electrical current. That's how nerves work. So if you're potassium deficient, which a lot of people are, that becomes a problem. So if you have a heart condition, they'll tell you to go cut back on sodium. I agree with that 100%. But many times you have a potassium deficiency. So here's a tip I gave you a long time ago, and people loved it. I want you to go get something called potassium chloride. It's a salt substitute. And I want you to take your regular salt and mix it, let's say 1/3 potassium chloride and 2/3 sodium chloride, regular table salt. Try it. You'll probably never notice the difference. It'll reduce your sodium intake and increase your potassium intake. Then go to 50-50. Because again, it might be just too much for you, but you'll probably never notice the difference. And now, not only are you getting less sodium, you're getting more potassium. It's a great way to build up your potassium levels in your body. So it's a neat little trick. Everybody should do it, actually. Oh, got a sneeze coming on. Okay. Everybody should do it, but especially if you have a heart condition. You got to get those potassium levels up. It's really important. Sleep apnea, that's oftentimes the stomach pushing up against the diaphragm. The diaphragm, when you breathe, the diaphragm drops down. When you exhale, diaphragm goes up. Well, if the stomach is right up against the diaphragm and the stomach won't allow the diaphragm to come down, you can't breathe as well as you should. And many times when you're laying down, you don't have gravity assisting pulling the stomach down, and you gasp for air. And so I remember my father had this. I didn't know about adjusting the stomach at the time. And you pull the stomach away from the diaphragm. In many cases, the sleep apnea is a thing of the past. And it helps the stomach digest food and break down proteins. And it takes the stress off the vagus nerve. And the vagus nerve affects the heart many times with the fluttering. So oftentimes, your health problems are connected. And it takes a lot of experience to go down that rabbit hole. Is this causing this, causing this, causing this? Yes. I did a consultation the other day with a woman, and she was starting to have memory loss, and she was in her 70s. And her brother was there. And I thought it was her husband. I didn't know who he was. And anyway, as I'm talking, he interrupts me. He says, I'm starting to get cognitive impairment, memory loss. He says, I've been to so many doctors. No one ever explained it like you just did. In 5 minutes, I understand it because I've always had digestive problems. Can I be your patient too? It's kind of cool. So if you'd like to be a patient, go to our website, drjoe.com. We'd love to see you as a patient. We have offices in the Atlanta area, Marietta, Duluth, Stockbridge, and West Cobb. We accept all people, insurance, no insurance, cash patients. We want to be your doctors. We want to get you well and keep you well. Please follow us on social media at Dr. Joe Esposito. If you're a podcast junkie, just type in Dr. Joe for the health of it, Dr. Joe for the health of it, and you can get our podcasts. And the website, drjoe.com, you can book appointments, order supplements, send me questions. We want to be your doctors. drjoe.com is the place you want to be. Folks, I can't thank you enough for making us what I believe, all my shows, I think we're the #1 health show in the country. So thanks for doing that. I'm Dr. Joe Esposito. Catch you next time. Okay. We got a lot more we didn't cover. Gosh, I didn't think we'd have enough. What you got?
So someone was asking, what supplement should everyone take?
Dr. Joe's Super Greens and Dr. Joe's Essential Source is the starting point. But that's like saying, which child do I want to save in Sophie's Choice? Super Greens and Essential Source, absolutely. Blood pressure issues, nitric oxide. I take digestive enzymes when I eat cooked meals. I take vitamin D every day in the winter and in the spring until summer and I'm outside. I take adrenal support because of stress in life. I take estrogen regulator, helps prevent my testosterone from converting into estrogen. I take omega-3 fatty acids for brain function. So what I suggest you do if you want to put together a protocol, you can either come in as a patient. We'd love to have you. And the first visit is $299, and that covers exam, x-rays, consultation, first treatment, complete nutrition evaluation. If you just want to do nutrition, we can do that. That's $200. So whatever works best for you is fine, but minimum would be Super Greens and Essential Source. But that's like just enough to keep you going. It's not everything you need. What else?
So another person was asking, why do you sweat when you eat food?
Why do I squat when I eat food? Sweat. Oh, sweat. That's the vagus nerve. That's stimulating the sympathetics and the parasympathetics, so it's probably the stomach up against the diaphragm. I think they said, why do I sweat? Why do you sweat? It's probably the sympathetic nerves and the vagus nerve, and you want to come see us, and let's check that and see. What else?
So what do you think about blood type diets?
Dr. D'Adamo wrote the book, Eating Right for Your Blood Type. There's some validity to it. I don't agree with it. I don't think it should be your end-all, be-all. But Dr. D'Adamo based it on his father's research, who based it on Dr. Kelly's research, who was a dentist. I think it was in the 30s. Don't quote me exactly. And Dr. Kelly, who was a dentist, found that his patients that were really sick, that had type O blood, this is one example, did well with small amounts of raw organic meat. They probably would have done well, too, if they went to a plant-based diet. So it's okay. I don't think it's a bad thing, but I don't think you should base your whole healthcare plan on the blood type. So I'm not against it, but I think there's a lot more to it. Read my book, Prescription for Extreme Health. I think it'll answer a lot of questions for you. What else?
So why would someone eating a SAD diet be protein deficient?
Standard American diet? It's probably too much protein, and you're not breaking it down and absorbing it. So it's not that you're protein deficient, you're digestive deficient. So you need stomach acids to break proteins into amino acids. And if your stomach acids are low, if you have acid reflux, you have pinched nerves to the stomach, that can prevent it. So if you're eating a standard American diet, you're probably not protein deficient. If you are, I'd say there's something else going on. You might have bleeding inside the intestines. You might be not digesting your food properly. You're getting enough protein with the standard American diet, which is a horrible diet, by the way. But there's plenty of protein in there. So, and in all my career, the only time I've ever seen anybody protein deficient is if they were anorexic, they had severe diarrhea, they had cancer. But I've never seen somebody without those conditions protein deficient. Never. So the chance of protein deficiency in our society is extremely rare. What else?
That's all.
Okay, folks, I want to tell you this. We're going to launch another master class. It's going to be free. Today is February 13th, so it's going to be a week from today, in case you listen to this on a replay. February 13th, 2023. So if you're dealing with brain fog, anxiety, digestive problems, weight loss, what's holding you back? The master class, if you didn't attend my last master class, it's amazing. And what we do is we want to pick out the 1% of the people, it's called the 1%ers, that really want to take action and be healthy. So great news, Health Plus Academy, that's what we call the master classes, Health Plus Academy. So I put together a program to personally coach you and help you every step along the way. Last time we did this master class and the 1%ers, the health hackers, more than half of the class were already patients of mine. Some of them patients of mine for 20 years or more. And they said, Dr. Joe, you give it to us in bits and pieces. I need you to hold my hand and carry me through the whole process. Registration is free for the masterclass. Again, it's Monday, February 20th. You can come in person. It's a rare opportunity. I don't usually do in-person lectures. It's going to be at the Concourse Athletic Club in Sandy Springs in Atlanta, or it's going to be live on Zoom, so either way. So 7 p.m. Eastern Standard Time. It's going to be about 2 hours, so set aside 2 hours. Now, the master class, I'm going to give you, I call it the 7 of my personal health hacks that you need to be healthier, happier, and more prosperous. The master classes are amazing. It's just me talking for 2 hours. It's very intimate groups. You have to register to attend. So I'm going to put the post link on Facebook or on Instagram. You can also go to my website, drjoe.com, send me a message that says masterclass with your email address, and I'll register you personally. So it's going to be on Zoom. It's going to be at the Concourse Athletic Club in Sandy Springs, 7 o'clock on February 20th. So you don't want to miss it. It's one of my rare live lectures, and it's going to blow your mind. And it's the introduction to the coaching classes that we have. It's just crazy how much information you're going to get. You think the shows are good? This is beyond that. So it's going to be at Facebook and Instagram, or send me an email, drjoe.com, with your email address. Put masterclass. I'll put you on the list. Other than that, folks, it's exciting. I hope to see you all next Monday night live. If not, I'll see you Sunday night at 95.5 FM in Atlanta. And I'll see you next Monday for the podcast. So see you then.